Dakota, and then ended up moving in my late teens to Sioux Falls because I met a girl, and yeah, so that's how I ended up in South Dakota. Ended up going to South Dakota State, switched from pre-med to journalism, and really loved going to the J school there. Worked at the Collegian, was editor there, and then worked at the Watertown paper and the Rapid City paper before going to grad school in Kentucky, and then got back into the business covering energy in Wyoming, and then moved to Ohio working for the Cincinnati Enquirer. Ended up covering the 2016 campaign out there, which was, I think you can all remember, interesting. And certainly an interesting time to be in a, yeah. And then moved here, originally covering business in Sioux Falls for the Argus Leader. And then Forum Communications, which is my current employer, they're based in Fargo. They own papers across the upper Midwest, the Dakotas and Minnesota, including the Mitchell Republic. They created a new health coverage position and reached out and wondered if I'd be interested in it. And I jumped at the chance. So that was late 2019. And yeah, the original idea of that job was to, there was a lot of reader interest in health topics, everything from wellness topics to new research that was coming out, to regional trends. It was not supposed to be a big breaking news beat or something where I was dialing in to question the governor of South Dakota every day. And yet within a couple of months, my job changed a lot.
Right. Well, that could be a real mind switch on you. You know, it's like you come in and think you're going to have this like sort of almost academic job of explaining science to people, and suddenly you're on the bleeding edge of controversy. That could be quite a head shaker. Well, tell us a little bit about what it means to be a health reporter. I mean, the COVID, which we're going to get to in a minute, COVID aside, what's the big challenge in terms of talking to people about health issues?
So being a journalist is fundamentally about, well, part of it's finding things that people don't know and telling them about it. But another part, more broadly, is taking something that's complex and explaining it in a simple way for people who don't have the time or aren't experts in the field. And that is never more true than in health and science reporting. These are not simple topics. The healthcare system, I don't know if you know, is not a simple system here. So just navigating healthcare is hard enough, and science reporting is difficult. So I saw it as a real challenge because it takes another level of work for, because I have to understand something before I can explain it to anyone. And it takes another level of research and thinking and thinking about how I'm going to communicate something. And it's definitely a higher order of work to explain science and healthcare. And I saw that as a really interesting challenge. That's probably the main immediate challenge.
Can you give me some kind of idea about what are the things that make that challenging? Maybe some anecdotes or something.
Yeah, I'm trying to think of a good example. Science is just hard, right? I mean, you talk about, so for example, any day of the week, you can go online and find a news article about research that tells you exactly in a definitive way a thing, right? If you drink red wine, it will cure your diabetes or something like you'll find that's too dramatic, but you know what I'm saying? Like there's these very straight cause and effects, and we've all seen it, right? Coffee's good for you, coffee's bad for you, red wine's good for you, red wine's bad for you. And I think, what makes talking about science, specifically science reporting, difficult is that the scientific process, I mean, I think it's sexy, but most people don't think they don't understand it's an iterative process, right? Where it's a little bit of work stacked on top of other work, stacked on top of other work. And as you learn something new, your old understanding will change. And that's really hard for people, I think, to understand. I think that's just a human thing, because you want to believe when an expert tells you something that's just the way it is. And the great thing about science and the hard thing about science is that it's not the case. It's all about experts admitting that they have learned and they might have been wrong, but now they know better. And that's a difficult thing for people to grasp. So that's certainly, that's certainly been a big challenge.
Well, it always occurred to me that people like absolutes. And if there's one thing that science doesn't do, it's absolutes. You know, it's like they like to say definitively this is true or not true. And
Right.
Science deals with probability, and they deal with that. Many people deal with absolutes. So that's a hard translation. How do you navigate that?
By trying to be as honest as possible. It's hard. Journalists like absolutes too. And especially when you try to write a headline, or people who are writing headlines, right? It's hard to put a lot of uncertainty in 5 or 6 words. And it's easier even when you're writing about something to say like, scientists now know, right? Blank. When that's, so it's being very careful with language and being very careful to emphasize what we don't know still and how this has changed from before, and trying to explain the process. I think that's one crucial thing is for people. The more you can gently remind people about what the scientific method is and how it adds information, and sometimes you end up ditching old information. I think you do people a service that way. So being clear about doubt, being clear about the process. Being clear where scientists, and I'm speaking generally, but where something they thought was true before has now been disproved. I think that just being as open and transparent as possible about those parts, I think, is how to do that responsibly. But it's very easy to do it irresponsibly.
Yeah. It reminds me of the difficulty of when people say they just want the facts, but if you give them facts, they can't make heads or tails out of it. You have to create a narrative, and the narrative already starts to distort the truth because it puts it into a context, almost like a mythological story. And then even when it's true, in some contexts, it's not true, instead of just saying, here's the raw facts. But focusing more on health itself, health is a lot of different things. What kind of things do you look for in terms of your general COVID aside? What kind of things are you looking for to talk about that you find your readers want to know about?
It's especially after this last year. Anytime I'm not writing about COVID, it feels like a vacation. But trying to explain how health systems work, where they work, where they don't, helping people sort of navigate just their day-to-day healthcare interactions, right? What stuff about bills, like why is the bill this way or not? And then people have real concerns about how they're covered and what that means, right? Talking about something like Medicaid expansion, that affects a lot of people's lives. So, looking for things that people immediately jump to and say, oh yeah, that affects my life, right? Part of my beat originally was to also focus on Stanford Health, which is of course big health system based in Sioux Falls, with a regional presence, and they also affect a lot of people's lives also as employers, right? They employ thousands of people, and so sometimes if you don't care about Stanford, you might not care about some of that stuff, but some of the internal stuff that happens in Stanford matters for thousands of people. So I look at things like that, and then also regional issues, right? We've got a real problem with mental health and talking about suicide prevention in the Upper Midwest. It's not just here, but it's certainly a struggle here. And so that was something, especially pre-COVID, I was working on, looking at how states were really starting to dig in and saying, how do we reach people where they're at, right? How do we reach the lonely farmer, and not talk down to them, or not be condescending, but try to connect with them on their level, to have a real honest conversation about a topic that can be really hard to be honest about with people you don't know. So those were things that I would focus on and hope to focus on again.
Well, you brought up an interesting topic. One might even call it a sidebar, but it's an important one, and that is the difficulty of explaining something simply to people who are not even familiar with a concept, but not condescending. How do you navigate that? What do you look for, or what's your approach to dealing with that?
First, do the best I can in the amount of time I have to understand something cold. The better I understand something, the more simply I can explain it. And so that puts a lot of, that immediately puts pressure on me to not, I can't, this isn't skimming, right? You can't skim and do justice to a difficult topic to someone who's coming at it new, coming at it fresh. So that's the first challenge is coming in that way. And the second is making it accessible. Even to word choices, right? Is going through something I write and say, okay, I'm going to ditch that $20,000 word, right? And use this word that people actually use in everyday conversation. That's thinking about it that way. Finding actual people, right? Not just interviewing experts about a topic, but finding people who are affected by it to talk about their own experience. People can relate to that. They're like, oh, that person's like me, right? Or, oh, that's exactly what I've been thinking. And so that also makes something that could be difficult or complex more understandable for somebody. So that's probably some of the main approaches.
Mm-hmm. So it sounds like using the narrative to create a story, and people expecting that somehow they get the concept, even if the actual details may be obscured.
Yeah.
Yeah.
And I think sometimes people would look right past, you could put a list of facts or a list of numbers on a page and people are just going to glaze right past it. If you lean into it with, and you need to be smart about it. It's not just man on the street kind of things, right? You're finding people who are actually affected by something to talk about their own experience like that. People love stories. I love stories. We all talk in stories. Did you hear what so-and-so did? You're telling a story. So that's I think an incredibly important tool in journalism, to tell a story as a way of bringing somebody into a complex topic, because once they're in it, once they've kind of bought in and realized that why this matters to them, then they're ready for the drier part, right? The hard part.
Sure. They'll put some effort into understanding that $20,000 word if they're already emotionally attached to needing to know about that thing. Yeah. Good.
And then it's on me to explain that so that they come out of that with actual new knowledge, right? Something that affects them and that can make their lives better.
Mm-hmm. Mm-hmm. So now let's talk a little bit about COVID, So as you mentioned before, that really sort of, just events, life events, said, okay, you probably thought you were going to be talking about third-degree burns in the summer, but actually we got this other thing, that's been introduced, that's much more important than that. So can you tell us about how that change affected you in terms of like your approach to writing, and then what happened to your beat, so to speak, as a result of that?
Talking about something like a virus it's the same sort of science community. It's just the same stuff we were talking about, right? About making something complex simple. The challenge immediately was that we didn't know a lot about the virus, right? It's not like, I could consume everything that we knew at the time when we're talking, say, mid-March last year, like a year ago. I could consume everything, read everything about the virus, and I'd still have to, if I was explaining it to readers, and I was trying to, say, this is what we don't know, or we don't yet know blank. There was a lot of uncertainty in those early days. There was a lot of uncertainty about how much it travels as a sort of a respiratory pathogen versus a contact thing, right? And so that's why, part of why initially you had everybody's like, oh, you got to wipe. My parents were like wiping down their fruit and leaving it out in the garage. just in case the virus was traveling on it. I mean, that was in the early days. We were working with relatively limited information, and that made communicating about a complex thing really, really difficult. And then, of course, everything was changing constantly. I mean, it's literally every day. It was, sometimes 3, 4, 5 different news stories about new things closing, and there's new cases over here, and we don't know when we're going to get testing, and now we've got test kits but they don't work, or test kits but we don't have the equipment for them. And so it was those early, especially those first several months, was just an overwhelming avalanche of trying to juggle lots of new developments and new information with a lot of questions and uncertainty, and try to be useful somewhere in the middle of all that. So that changed my job, obviously, dramatically.
And what happened as a result of you starting to wrestle with those stories? What kind of feedback did you get?
Well, my job instantly became a political job. I didn't go into the health job thinking it was going to be a politics job. I certainly never thought I'd be, like I said, like, talking to the governor every day in a press conference. And that's quickly what my job turned into. And then increasingly, of course, talking about COVID was talking about politics. It was talking about what Trump was saying. It was talking about what the governor was saying. It was talking about what local leaders were saying. And, I'm not going to come to you and say, like, these shouldn't be political things, because of course they're political things, right? Like, anytime you're talking about changing people's lives and their elected officials have something to do with that, you're talking politics, and it's just politics, and you're there. So I never was one who was saying, we just need to divorce the science from the politics. You can't do that in a case like this, in a public health, like a pandemic thing. It's all in the same boat. So that was, I think, a challenge, and I wasn't really excited about instantly covering, being a political reporter again. I honestly came out of 2016 was like, if I never cover politics again, I'll be okay. I'll be just fine with that. And so I felt like I kind of got dragged kicking and screaming back into covering political topics, or health topics as political topics. And not a lot of joy in doing that, but it needed to be done.
Yes. So when you're talking about COVID to the public, and we talked a little bit about why that's complicated in general in science, but and the politics of introducing that into it. Are there other things that you saw that the perception of a problem was different than the reality, and so talking about the reality of the story was difficult because there was this hurdle of getting over what people wanted to or needed to believe, and then you're telling them something that comes in conflict with that, but you have on good sources that says, hey, this is the case. How does that make any sense, that conflict?
Yeah. So I ran into it at every level, and as you can imagine, COVID-19 became everybody's favorite topic. Not always by choice, but it was certainly something that was on top of mind for everybody, right? So everybody had opinions about it. Everything from what people should be doing to what everybody became like a science expert simultaneously. It was, and I get it. It's, when COVID is dominating your life, you are reading tons of things about it, and you have opinions about it, and you make decisions about your own life. So you think, you want to express those decisions and sometimes tell other people what to do. And so, everybody from politicians to the public, over time, Governor Noem's recommendations on things like masking went from being, the stuff she was recommending in March and April was it was what the CDC was recommending. It was what all the public health experts were recommending. And then over time that changed based on new science that was coming out and a better understanding of the virus, realizing it was transmitted, primarily through the air on respiratory, through droplets. with people realizing masks actually could be really effective there, and especially widespread use of masks could really reduce transmission. And the science on that just got better and better over time. The governor's recommendations on that never changed. And as the year went on, she was increasingly citing fringier and fringier sources for why masking wasn't necessary when everybody else had moved on. Science fundamentally moved on, public health had moved on, and the science that was being done by the CDC and other people kept showing, again, more and more, like widespread masking. If you stop people from breathing into each other's mouths, they don't make each other sick, just in a really straightforward way. So
why would we
that
want
was
to
a
do
challenge. Yeah. Exactly. The other thing that was really interesting, I built a lot of new relationships with a lot of people I've never met online, right? Through social media, people who connected up with me and said, I'm really interested in this, and I've been making my own spreadsheet of all the cases, and I've got some analysis I want you to see. And I'd say, sure, like send it to me. There were more people, I feel like, doing sort of their amateur statistical work, and I think a lot of it was just because you want to understand, right? And if you feel like you don't understand, you want to get some control over the numbers and really see it for yourself. And so a lot of people are doing that by themselves, which I thought was great. The downside was that you had people would kind of pick their favorite number, and then get really stuck on it, and then come to me and say, you are doing a terrible job. You need to just focus on this, right? You just need to focus on hospitalizations. It's the case number that matters, but no, it's the testing, and you need to look at this positivity rate, but not that positivity rate. That's the one that matters. And look, there's something to be said for all that. I think, we were tracking all these numbers and doing our best to express the big picture of what was happening. And it got tricky at times, navigating that, because each sort of data point tells a different story, and you're trying to be accurate about what's happening, but also give people wider information so they can make their own decisions too. And so it's kind of a weird balance. But I don't know, it's a weird job when you're kind of catching it from all sides. And usually in, say, other coverage, you're like, well, that means I'm probably doing a good job. In this case, sometimes there was good checks there where people would reach out and be like, hey, that's a dumb thing to focus on. And I'd look into it and be like, ooh, I think they're right. So it wasn't all bad. It was helpful sometimes too.
One of the things that I was kind of surprised at over time was, let's take the masking issue, that there did seem to be enough, let's say, reporting on the fact that the masking thing wasn't new, that like this Chinese doctor had shown that, and they gave it, pretty much the medical establishment poo-pooed him too, saying, oh, this is like, that's more or less too simple. But after that, it had become like a standard in terms of once you found that something was airborne, it became a standard of masking. And all along, in every situation, people always resisted it. I mean, it was one of those kind of things. It's like you're interfering with their breathing, even if they still can breathe. They now are conscious of their breath, whereas before they just breathe and almost until you stop it or restrict it, they don't even know they're breathing. I think that there's a certain psychology of like resistance to that. So I didn't see one, the acknowledgement of that, and also the perspective, to explain that to the public that, okay, look, this is going to be it's going to be uncomfortable for all of these reasons. This is why you're feeling that, and it's perfectly legitimate for you to feel that. But there's the other side. If you have the choice of feeling that or transmitting the virus, you're going to choose. You can say it's your freedom, but this is what you're choosing. You can have all kinds of excuses. I didn't see that. I haven't seen that, but I don't read every newspaper. Have you seen that kind of approach?
Not quite. I mean, I think, what you're bringing up is actually something that's a real conversation that's happening now in the public health community and in science communicators in general, because if you look at the conversation about masking, especially in the beginning and middle of last year, they screwed up. They started out basing off, limited information, and then with an eye to, a limited supply of protective equipment, including masks, saying, no, people don't need to use masks. Don't be silly. Stop using masks. Save them for medical personnel. And some of that was shortage based, and some of that was not having a clear idea of how COVID spread. But it was so definitive, right? I mean, you had the Surgeon General coming out and saying, you don't need to wear masks, don't wear masks. Speaking of absolutes, right? So there were absolutes coming out about masks. And so when over time, and it happened fast, right? We're talking a matter of a couple months, the science started really coming in hard and fast, and the evidence was there. And then they also realized, like, oh, just because we have a shortage of, N95 masks doesn't mean that there's not some benefit to cloth masks or the disposable masks that you see, the blue ones. That there's some value to that in a widespread use, and there always was. It's not that the value changed; it's the understanding of that, and then also understanding how respiratory COVID-19 was. Suddenly, then all the public health agencies started changing their tune, and it makes total sense that the public would just be like, "Hey, like, why are you changing your mind?" Right? Like, there was I think a poor job, and I look back and I could have done a better job too at saying, here's why we're changing our mind, right? We were wrong, or that was the best we knew at the time, or something. Based on new information, this is what we have. This is why we're saying this. And I think in the rush to provide very simple, clear-cut instructions, there wasn't a lot of context given, and there wasn't a lot of explanation for why everything was suddenly shifting. And when that happens, that's how you build distrust. That's, in a lot of ways, I'm not surprised. And there's certainly people out there spreading lies and incorrect information about a lot of things too. So I'm not, downplaying that. But the public health community, I think, didn't do itself a lot of favors in explaining why they were changing recommendations, and it made people not trust recommendations.
Right.
You can't trust people.
It's worth remembering that at one point, the Surgeon General also said that cigarettes were good for you, so.
Yes. Well, and that's just it. I'd have people reach out and say, again, that's the kind of stuff that means we can't trust anybody. You can't trust those experts. And then where I came back was like, well, then who are you going to trust? Like, do you want to trust your friend Gary on Facebook that he knows something about science, and like,
you Alex Jones
based on Gary? Yeah, well, and people did it. And I don't, I would pray that they'd get information from a better source, but I certainly understand if you don't trust people that you've been listening to, you're going to go somewhere else. You're going to find somebody else that you can trust or think you can trust.
Sure.
And that happened last year, and it contributed to a really unfortunate, very politicized, overly politicized fight over whether masks work or not, which was increasingly not based on science. It was just based on information and people's feelings about their rights.
That's why I wanted to almost begin with the idea that we expect one thing from science, but that's not what science does. We treat science as though it was religion, where you have absolutes. This is true. But in science, there is never. And so I think that's part of the problem too, is that science is evolving. And so what I tell you today is true until I get data that tells me it's not true, or it's true in terms of probability, not in terms of absolutes. So it's very difficult to have a conversation when people are on different communication tracks, the way they. So it gets back to those $20,000 words again. And then when you make the narrative and when you're trying to explain things in the simplest way, you leave out really important information that at some point, becomes important and crucial information.
Right.
Like the baseline of like science doesn't do absolutes.
Yes.
If that's not in the back of your thinking when you hear a scientific report, you think, oh, that's the truth, or that's what it is now. Now that's what it is today, and then tomorrow
Right.
it'll be something different, because that's how we do science.
Right.
Yeah.
And that's, I think, a fundamental, I don't think, I would like to think that people came out of this year with a better understanding of how science works, and I'm not sure that's true. I think a lot of people came out of this last year believing that science is a bunch of ivory tower idiots who don't live in the real world, and it's people who want to tell them what to do, and they're probably wrong. And that makes me very sad. That's not true for everybody. I know a lot of people who learned way more about science over the last year and learned, how to understand those concepts and applied them in their own lives. And so that's absolutely not true that it was everybody, but I don't know. I come out of this year feeling like I think we did the best we can in terms of communicating some of this stuff. I think we could have done a better job. And I grieve for the people who came away from the reporting and the public health recommendations that were out there saying, I can't believe those people, I need to go turn to Alex Jones, to Uncle Gary on Facebook, right? That's not helpful. It's not going to make their lives better. And those are not good sources of information.
Well, I think I'd like to hear some questions from our other participants. Do you all have any questions or comments on what we've been talking about?
I was reading an article this morning about the extent to which our two-party system is jeopardized. The writer said, the two-party system doesn't work if you don't have a shared reality. And, a few years ago, even the possibility of that would have seemed kind of unbelievable, but now it's the way it is, isn't it? That we don't have a shared reality. And so, hats off to you for doing whatever you can do about that. But I think South Dakota is an especially good example of that dichotomy. So what's to be done, not only in terms of COVID, but in terms of preserving the American experiment, if you will. Are you hopeful about all this, Jeremy, or has this experience discouraged you? Or you see anything trending toward the light in regard to all this?
Those lack of shared experiences, I think the election certainly is a great example of that, right? Where there's a significant percentage of the country that firmly believes that election was rigged, that Biden's not a legitimate president. And I 100% agree. You saw that same split happen in COVID. Late into the pandemic, I've got one friend whose name I won't mention, who was telling me like a COVID reporter, oh, it's not as bad as the flu, or it's about as bad as the flu, or something like that. And it's like, you got to be kidding me! Like COVID's already the second highest cause of death in the state. That's the way it blew past flu like a long time ago. Like, you can't tell me that you think that. Like, it's not based on any actual evidence. And I think there is something to that with COVID still in South Dakota, where there's an alternate reality on it. I think one thing that changes that is when it affects you personally. I know people who thought COVID were saying all the things about, oh, COVID's not that big of a deal. Oh, it's not that real or whatever. And then they have a loved one who catch it, or they catch it. And usually their tune changes real fast, right? So that's, when I think about that, and not that I wish tragedy on anybody, but I'm trying to think about how to give people those shared experiences again, right? Like how to bring people together saying like, you're having the same experience now. And I think a big part of that is information, and it's on outlets like Facebook and people like me as journalists to try to give people that shared set of information. But I don't know how to convince people to trust me necessarily, right? If they've decided I'm not trustworthy and everything I print is lies, I'm not sure what to do there. So I struggle with that. And I think if you look at whether I have hope for the future on this, something needs to change. The way people get their information needs to change fundamentally. I think how people get their information, and social media has been a big part of this, has exacerbated the polarization that already existed in this country to such an extent that people can live their own worlds because they can surround themselves by media that completely fits their point of view. They're not faced with positions that necessarily challenge them. And so their own opinion is constantly reinforced, and then it diverges, right? Everybody goes off on their own tangent and you never bring people back together. I'd like to think that I can help do that somehow. But I think I'm just part of a larger information ecosystem that needs to change in really fundamental ways, or we're just going to get further apart.
Jennifer, were you going to say something?
Well, I was going to ask sort of a pie in the sky kind of question, because I first of all, thank you for all the work you're doing. You're doing one of the most difficult jobs in a time when on one of the most difficult topics, because I think our society as a whole, as you've pointed out, doesn't understand science very well. And also I would say they don't understand journalism very well. So sometimes I've heard some conversations between journalists and other people who are just interested in where we get our information, talking about what could we possibly do, because you can do your job perfectly, and if you don't have an audience that's willing to put some trust in your work and to consider it really accurately, it's going to fall on deaf ears. So there's been some talk about, is there anything that our education system could do, or whatever it might be, that you think would be helpful? And I think that goes on both sides. One is the scientific side. I mean, we all learned about the scientific method in, middle school or something like that, but apparently we've forgotten a lot about it. I used to teach at the college level, and information literacy was a part of what we talked about, but I don't think we did an especially good job of that. So if you had your, dream, you could just make anything happen at the K-12 or college level, what do you think? Is there any way our schools can help with either the science or the journalism, so that we have a more receptive public?
Ooh.
Yeah, I know.
So I'm part actually in my company, part of an initiative that's working on thinking through how we do opinion reporting, what editorial pages look like, and just sort of news literacy. And some of this is directly connected to this, right? Trust in journalism is down like lawyer level in terms of professions that people like. And you're right. I don't think, I could do my job as I know it now perfectly, whatever that looks like. And I don't think everyone's going to start trusting me. So, a couple of things. So I'll say this, doing something like this, I think, is important for people like me, because the more chances that people can talk to me as a human, and I can explain my process and they can understand how I do things, I think that helps a lot. I still run into people who say, oh, you like pretty much pre-write your stories before you report on something, right? And I was like, what? Like, I don't know how that works. Like, how do you? But people just don't understand. Journalism is it's a weird black box to most people. And I think the more people like me can get out and say, this is how we do it, this is how we navigate it, this is how the process works, I think that's really helpful. There's a lot of people that are really interested in that. And I think the more I can explain what I do and other people like me can explain what they do, better. And then take honest feedback too. The other thing that I'm recommending in that initiative, and this is something you talk about, education opportunities. I want to teach people how to argue better. Like, I want to teach people how to have constructive arguments, even with themselves, right? So much of the conversation that I see is people talking past each other. And it's not like, well, we just need people to like each other. No, people need to understand how to make an argument, how to realize that making an argument includes looking at opposing arguments, and maybe, you're preparing responses to them, but at least you're considering them. So I think, just not just in written arguments, but in person arguments, and certainly looking at how you engage with people on something like Facebook and realizing like, oh, this is not a real argument. This is just people yelling at each other, right? I want to be part of this. So that's what I would love is there's absolutely a science literacy part, like you're saying, that is, I think would be crucial. But I think the larger sense of bringing people back to that shared reality, I think is trying to help people understand how to make their point better, and to make that point by making a better argument, which includes looking at people whose views are different than yours and actually grappling with their position. I think that's a basic skill that we rarely deal with anymore. And I got to say, I went through, I think I had one professor in college that started teaching me that. And I feel like I didn't get a good grasp on how to do that until I was in grad school. And not everybody's going to grad school or even, undergrad to get those sorts of skills. So that's what I'd love to see that taught more.
On that same subject, it seems like it goes back to the science thing. If you can do first critical thinking, and then being able to have an idea about critical thinking, you can graduate to the scientific method. But you can't start at the scientific method when you can't do critical thinking. And part of the whole process of critical thinking is first arguing with yourself. It's like before you take the argument to someone else, you have to learn to argue with yourself and debate and like, well, what do I think? Like listen to asking a question that ultimately you get to in a scientific method. What would prove me wrong? What would I accept if I saw that I would be wrong? If you can't answer that question, then you have not investigated your issue well. So, and I don't think that that's a college course. I think that's kindergarten. It starts at kindergarten because on some level, that's what they have to deal with. That's why Johnny hits Frank with the brick, is because he hasn't been able to do that yet. And so getting people to have that skill, that, because it has to be at the gut level, not at some kind of high cognitive level where only the people who have the secret handshake do it. Otherwise, otherwise you don't have enough people to carry out that process.
And I think the media world used to depend and just focus on people who had those skills, right? And then treat everybody else like they were just there to watch, and which is pretty condescending to begin with. But I think that's why the democratization of media and social media in a big way has given everybody a platform and a chance to talk to people otherwise they might not have talked to. And originally that was a utopian idea. Like now we're all going to understand each other, and that's not been the case. I would say at all.
Sure. Anyone else have any comments, observations, questions? Because I certainly do. Wait, go ahead. Anyone else? Well, hearing no response. So let's talk a little bit about getting past kind of, I think what Jennifer was referring to is like getting to, well, how do you get people that are not the chosen ones to actually be involved or get involved? I'm thinking something like narratives, and I hate to get into docudramas and that kind of thing, but putting things into into people's emotion. In other words, I can grasp it, because if I can't find an emotional attachment to it, there's a good chance that it's not going to be a story. Even if I understand it, it's not going to stick with me because it doesn't have any emotional gravitas. That's just a psychological discovery. Okay. So what is it that you can do, or are you doing, that makes the story real? And then how do you get feedback on whether or not that's working or not, that a story is poignant to people?
Well, there's first finding those people is a challenge, especially these days when you can't just, it's both easier and harder to find people. It feels like during COVID. Sometimes people are a little easier to get on a video chat or a call, but it's a little harder. You're not making the same connections that you can use to find people who have that really telling story, right? So that's probably the biggest challenge that I deal with, is trying to find people that fit that. And so a lot of it's just sort of staying open to obviously building out just connections with people that hear things, right? And then listening for somebody that's got something to realize, oh, that's something that's going to be a good face for this thing that I'm trying to communicate, right? So that's a big part, is trying to find those people. It's probably the biggest challenge, but it's also the most rewarding part. What was the second part of your question? Sorry.
So how are you going to deal? Oh, that was the second part, was how are you going to deal with it?
Yeah.
But finding that emotional, how do you put that emotional, what's a framework in which you can put that emotional connection? In other words, bringing it home. What techniques do you see going forward to make that happen?
Finding more ways for people to relate to. So in 2 weeks, I'm launching a podcast through my company. I've never made a podcast before. I mean, I've spent the last month trying to teach myself audio editing to try to make this podcast. And I think a big part of that, right, is reaching people where they're at. I think the more you can do that, the more with those stories, right? A story doesn't do any good if people don't hear it. And I think coming up with trying to meet people where they're at in different formats, I think is crucial to this. And it is part of, look at what I was talking about, Jennifer, earlier, is being willing to just talk to people as a journalist, as a fellow human, and talk about my experience and how I do things. So journalism's not such a black box. But then also meeting people where they're at, or the types of media they consume whenever possible. And then you mentioned, the other thing I think you mentioned was knowing if it works or not. And that's always a challenge. I mean, when something's online, you can see if people are reading it and how much they're reading it. And so that can be a helpful metric. Obviously, feedback that you get where people reach out and say, hey, that really meant something to me. That can be really useful. And I've also, this is a tricky concept in journalism, but using myself. So I got a vaccine, right? I've got the first vaccine dose, and I went straight to social media and put it out there. Like, look, here's how I got vaccinated. This is how I knew that I qualified. And if you want to find out, here's where to go. And somebody messaged me back and was like, hey, thanks for tweeting that out. Because of that, like, my mom just got vaccinated. So that kind of feedback happens, and you're like, okay, it's working, right? To even just use myself as that face if necessary.
Did you tell them
feedback thing can be tricky?
Did you tell them how you pulled the chip out of your arm?
Yeah, that one. I know people, and even family member who has thoughts and opinions on that I don't know what to do with, to be honest, besides saying, like, that's not the case. It doesn't. I'm not sure how much evidence I could present to change their minds, I think, at this point.
Usually it's not an evidence issue. That's what I've found. That's my discovery. It's like and I'm a scientific method kind of guy. I like to show me data, but it's been a really hard, speaking of emotional, it's been a really hard emotional change up for me to recognize the value of the narrative and fiction, and making a story for people. And I've been seeing it, but I didn't see it. I've been seeing it, like when you have the minister who calls up the kid to talk about the sermon, but really what he's doing is breaking it down for the adults, but he's making a little children's story about it. I mean, so I've been seeing that, but I didn't recognize what they were doing. And maybe it was because I was too engulfed in my own way of thinking to give credence to the value of it, And now that I've somehow, I could say, pushed off that cliff, then I think I now realize I have to think about that. I really have to break it to where, make it a story, make it in some other form, as you say, bring it to where people are. Going forward, recognizing the kind of issues that we've been talking about here, going forward, do you see changes that you plan to make as far as in journalism, what you plan to do?
I don't know. Like I said, at this point, almost writing about anything that's not COVID-19 feels like a vacation. So, and honestly, as much as, this last year has been hard on everybody. And it's been hard on me. I mean, this last year has been a mental health challenge for me, and I know it has been for a lot of other people. What I do going forward with this, I think there's so much still that we don't know from this last year. We don't know a lot of things still, right? When you talk about sort of the basic humility of critical thinking and the scientific method, like there's so much we don't know that we still need to know. And I think digging into some of those things and explaining that might go a long way to helping this last year be more productive and helpful for people and their understanding of the world and of experts and of people that don't think like them. I think there's a lot of progress we've made on that front by really digging into the questions that we couldn't answer. And so I expect to probably be doing a lot more of that along with non-COVID things.
Yeah. I'm thinking that, like if you do memorable stories that are short enough for people to remember and tell, then it might be, some possibilities there for a ripple effect, so that, you're only going to have so many people, and those people are already a selected group. People who get up in the morning and read a newspaper, they're almost as rare as hen's teeth, So so if you were to write a story that was, engaging, that those people would feel compelled to pass on, it's one of those kind of like parable things, like many religions have used that, where if you just tell people the rules, here's the 10 commandments, then okay, yeah, that's a thing and I'll memorize it, but it doesn't sink very deep,
Right.
So when you tell a story, or somebody will say, oh, be kind, be the good Samaritan, or everybody's your neighbor, be kind to, treat your neighbor as yourself. And somebody says, what's that? What the heck is a neighbor anyway? And then when you tell a story that, okay, it engages the principle that you were talking about, plus it tells you in the process that everybody is your neighbor. It's not, it says the neighbor is just, what is that? That's just a word. Everybody's your neighbor. The parable, when the parable explains that, then it's, look how long that story has been repeated, and how often it's repeated, because, so I'm just thinking, like, is there a way that newspapers, can start to engage that kind of strategy to get messages out?
Absolutely. Yeah, I think a basic ongoing problem in journalism, especially print and online journalism, is thinking that if a story is important, it has to be long. And that's not true. Just even some of those online metrics show that just because you have a long story doesn't mean people read it all the way through. In fact, most people don't. So, if you're looking for a story that actually affects someone's life, and there's no better example, like you say, than somebody using that to tell that to somebody else or sharing that story with somebody else. I think there's a lot of value in being concise, being very accessible, and having it be very clear. I think people value that now more than ever, more than they're interested in a 5,000 word pondering of some topic. They want to connect with it. They want to know why it matters, and they want it to be something that is something that they would want to share with somebody else and say, like, no, this affects your life too. So there's definitely a lesson there for us.
Yeah. Well, I think that gets to the fact that we have more things to do now. We're not, sitting around the campfire because there's no lights and only light is the campfire. We're not doing that now. We have all these things that we're doing, and that means we become, in a sense, more aware of time, and we have watches and we have clocks. So all those things make us feel more about time. And so I don't know that we use time better, but we're more aware of it. And so we have a shorter attention span. We want to do things. We don't want to invest a lot of time in something when you don't see some kind of immediate feedback, or at least immediately realize the potential of that feed, of that thing you're doing. So I'm just wondering if, maybe there's a lot of prep work that has to be done that may not be about a story, but about having people look at life different. So maybe it's some poetry, maybe it's some short stories that get people to recognize the flaw in not having an argument with yourself. Maybe some of those stories are the baseline for preparing people to hear what you have to say when you present a story. Just a thought.
Yeah, I think the more you talk about, we're talking about some lessons for journalism, I think, meeting people where they're at, it's not just a format problem or a media problem. It's like what you're saying, right? There's a lot of different ways to communicate important lessons. And I think I'm really an all of the above sort of guy when it comes to that. I think anytime you're helping people understand the world better than they already did, you're doing them a service. And I think that at the heart of it, to me, that's what journalism is.
Well, thank you so much, Jeremy. This has been a pleasure to exchange ideas with you. I wish you well in your journey, because it is a journey. And I feel for you. Even if I can't reach you, I'm feeling for you, because
Thanks.
It's a very complicated thing, but it's important. And so I want to thank you again for joining us, and thank you for the work that you do. Anybody else have any last minute things you want to say? Betty, you turned on your mic. You had something you want to say?
I just wanted to say thank you to both you and Jeremy. Very, very engaging. And I was all ears. I needed to be.
Thanks, Betty. I appreciate that.
Maybe one of the blocks I was thinking about that happens with me and others, they've decided, for instance, that some network or some news source is not anything they want to know. So they don't go there at all. And I'd have to force myself, and I've tried a few times to go to that side. So that's the big barrier. And I'm personally working on that. And I've kind of pulled back myself over the last year from some of the ways I approached my Facebook communications, and just trying to be a conduit in a way that will be more accessible to everyone instead of making them angry. Yeah, I'm so glad to know you and know about you. It's very good. Keep on on.
Thanks, buddy. I got to say, you said something that I've been doing actually in my own life too, is thinking about not just, looking at the other side of something, but realizing there's a lot of value in stepping back a little bit too. It's always, I think, between social media and cable news, it's always easy to always be on and always have something in front of you and something telling you what to think. And I found a lot of value in the last year in stepping back, turning off the social media, turning off the TV. And that quiet time, I think, really can help you be a little more grounded and think through things, actually think through things on your own, than hearing somebody yell at you. So I think that's a really helpful move. I know it's been important for me.
Me also. This is the most time I have spent with only myself in my entire life. And it has been such a surprise to me what a hermit I can become and how much I enjoy it, and the reading I can do and the writing I can do and the painting I can do and just the quiet. It's wonderful. So
that's great.
I hate to admit that I've enjoyed this hermitage, but
it's okay.
Well, we'll see you all next week, same time, same station. And until that time, peace be with you.
Thanks, Lawrence. It was a real pleasure.
Okay.
Thanks, Jeremy.